A World Health Organization report has found that children in England drink alcohol more than in any other country in the world. The research focused on children aged 11, 13 and 15 from 44 countries about their use of alcohol, cigarettes and vapes. International relations specialist Musa Mdunge joins us for more. Musa, good to speak to you this afternoon. Those numbers absolutely incredible. How do the rates of underage alcohol consumption and vaping in England compare to trends observed in other countries, particularly within the European context?
Thank you so much for having me here, Hugo. What was interesting about this study, if you look at it, particularly the countries that England was compared to, it showed rates in terms of teenage drinking, particularly whether we look at boys or girls, that were higher than even the countries of East Europe. What was interesting when you looked at this study, countries such as Czech Republic, the likes of Lithuania, the likes of Hungary, these countries that have been traditionally seen as the poorer countries when compared to Western Europe, have levels of teenage consumption that compared to England. In this particular case, what is interesting here is that England, the levels of drinking were compared to these countries, but rather when we look at it compared to its Western European counters, countries that are equivalent to England in terms of development, whether we think Germany, whether we think France, England teenage drinking was far higher. But in many ways, Hugo, that is something that we need to understand this and locate this within the economic structure and the socioeconomic conditions of England itself. So when we look outside of London, that is where this picture then begins to make sense, particularly when you look at the Midlands, when you look at Northern England, areas where where you had huge manufacturing jobs and plants in the 1980s and 70s. And with the economic reformation that was brought in by the likes of Margaret Thatcher, many of those jobs and industries died out. And what you then had were many of these pockets of areas, places that the Labour Party used to dominate, where economic conditions became worse. And so the conditions that would lead to people taking up alcohol, to people entertaining issues around drug use, certainly started to increase. And so when you were to do a mapping of where are the hotspots where we see teenage drinking the highest in England, it is in these places where there's a high level of poverty and unemployment. And that's the story that doesn't get told when you think about countries like the United Kingdom, because you often think about richer economies as doing well when it comes to even these social indicators. But in actual fact, England is a case in point where that is not the case.
So why should we be concerned by these numbers? Why should we be concerned that 11-year-olds, 13-year-olds and 15-year-olds are drinking at this stage? I mean, what does it all pan out to say?
Well, certainly, the very fact that you would have young people drink at such an age already means that for their, their opportunities, where the direction of their lives and the kind of opportunities that they would then get or be able to be exposed to would be then limited. We know that, just beyond just a healthcare sort of concern, there are also, the economic ramifications. In many cases, in places where we have seen a high level of underage drinking, it's been connected with a huge level of cannabis use, as this report pointed out. And again, the areas that we are seeing this happen are areas where crime is rife. But what is also here interesting, Hugo, is the very fact that, these numbers also apply whether we think of high income individuals and spaces as well. So it speaks to a culture of underage drinking in the country. But of course, when you think about what COVID-19 did, when you think about the fact that the UK has not recovered from Brexit, the cost of living challenges, my own experience here, even in Dundee, which in fact is home to the city that has the highest in terms of per capita drug usage in Europe, mind you. But when you then were to speak to locals and say, what are the things that are causing this? It's definitely a matter of the lack of economic development. And the fact that when you look at the UK, Hugo, one can't deny economic development has almost always been limited to London. And so when you go outside of London, that's where the questions arise. Now, why must we be concerned if we're thinking South Africa? I would argue that we are getting to a point where we're having a huge vaping culture developing in the country. And that is why the United Kingdom has, in its own policies, decided that it would ban vaping, for example, decided that it would ban flavored vaping in order to stop this, to stop what is attracting teenagers from seeing vaping as being cool. This follows, Hugo, what the United States did with the whole vaping culture there. And so for South Africans, certainly where we have a huge challenge around smoking of cigarettes, certainly vaping is the next thing. And I would alert parents to be mindful and to be awakened to the dangers of vaping and the ease in which teenagers are able to access these things. And certainly in South Africa, there are questions, Hugo, that we need to ask as we reflect on the experiences of countries such as the United Kingdom. So it is very much important.
So let's touch a little bit on public health implications. How could the high rates of underage alcohol consumption and vaping among children in England impact broader public health outcomes, and what are the potential implications for international health policies?
Well, look, I mean, the social implications or the challenges in terms of the countries, of course, one of the challenges that the United Kingdom is finding itself is higher levels of, for example, lung cancer, especially among young people, that is starting to creep up. And of course, the health indications here in the United Kingdom, especially for such communities where teenage drinking, vaping, and drugs is being used, is certainly a concern. Issues around crime, right? The very fact that people would then go into criminal activity in order to be able to source their addictions is another challenge that's certainly been a problem here in Scotland, particularly when we look at cannabis use particularly. And certainly for England in those Midland areas, certainly that is the challenge that they are facing. And this is happening in places where there's low-cost living, council housing. You know, the health outcomes in many of these areas are such that people are queuing at food banks, for example. And these are some of the challenges and why, you know, this issue is being flagged by Rishi Sunak. It's part of his campaign. He sees that it is something that he can potentially, march an election campaign on. And there's a support within the community, particularly among parents, to deal with this issue currently, both in England, but as well as in Scotland.
So what about the impact of cultural factors? Now, to what extent do cultural and societal norms influence the prevalence of underage drinking and vaping? And do these numbers speak to English children entirely, or do they speak to a cross-section of children in England that are those ages, or in the UK, even from other countries or other nationalities?
I would argue, Hugo, that it goes across the board here. This is not just a matter of just children in England, you know, throughout the UK, even in Ireland as well. Ireland itself is battling challenges around this very issue as well. So certainly, you know, within the British Isles, but as well as in Ireland, it is certainly a challenge. Even across Europe, it remains a huge challenge. So this is not just an issue limited to England. Even to some friends, you know, I've spoken to some guys when did they start smoking? And then you find that there is a culture, you know, of this thing having started at a young age, even in terms of drinking, where it is part of the culture, the norm, to give your child, you know, a beer, you know, or a bit of wine. It is not seen as being taboo in this part of the world. And that is perhaps the challenge here. And why, for example, again, the reason I say that you're quite correct when you look at it and you locate it from a cultural perspective, that this is not something limited to low-income groups. We are seeing it among the rich. that culture of underage drinking actually finds itself in those areas as well. That may well also have to do with the fact of a feeling that one is above the law, and the law does not apply. And that is again why, the United Kingdom, through its Youth Alcohol Action Plan, YAP, has really decided, for example, to strengthen regulations around checking people who are under the age of, if you look under the age of 21, Hugo, you are expected in the United Kingdom to produce an ID if you are going to buy any alcoholic drink. And so, these are some of the regulations, in fact, that they are trying to do. In fact, in a recent birthday party of a friend, that happened, where one of us were in fact asked to produce an ID, even though the person in fact was way above the legal age. These are some of the measures that England is trying to take to deal with this challenge. But unfortunately, it's so huge in terms of its cultural impact here that it's unlikely that the UK government will get around this issue.
Now, final question, does this have any implications on other areas such as teenage pregnancies or, sexual reproductive health?
Certainly, one would expect that it would have an impact, especially when we think about, teenage pregnancy, when we think about the fact that kids being exposed to sexually transmitted diseases. These things are a challenge that the United Kingdom is trying to deal with. And certainly in those areas in England where we have seen a higher level of drug use, of alcohol use, we've certainly seen a high level of teenage pregnancy that is above the average in the United Kingdom. So certainly, again, there are socioeconomic implications for what is happening in terms of alcohol use. But again, as you said, it's the culture here. There's a pub in almost every corner when you go to the city center. The pub culture in the United Kingdom is quite strong and is encouraged, and so again, when you are dealing with such a challenge, it is very hard for the government to then mount up a plan. And again, Hugo, why is this thing important for South Africa? Is because even ourselves, we have to look at ourselves in the mirror and say, do we ourselves in South Africa have a challenge of teenage drinking? We know what happened with that infamous incident that happened in the Eastern Cape. And such incidences must alert us to the dangers of alcohol, the excess thereof. But I would say, Hugo, I would really like to flag the issue here around vaping. And this is the next challenge that South Africa is going to face, particularly among teenagers. And unless government has a strong response now, a preemptive response, a proactive response, we will look into the same challenges that have been experienced both in England and in the United States, mind you, where teenagers have in fact died because of vaping.